Hi, it's Dr. Young. Thanks for listening to the video. Now I just wanted to show you what your options are for different types of contraception. So for women that don't want any sort of hormonal contraception, there are a couple of options for us. So there's the male condom. I'm not going to open it. This is a nice little package that it comes in. It's available pretty much in any store, pharmacy. There's also a way to go online and request condoms to be delivered to your home. They send it in a very plain package where nobody knows what's in them, and we'll put that link as to how you can request those in the video. There's also the female condom, which is a little bit larger than the male condom. It's available at pharmacies and drugstores and, like your Targets or your Myers also. And on the back of it, it has directions as to how to use this. Those are also effective at preventing infections. The other option is the fertility-based method. We have resources that we can give you as to how to learn how to do the fertility awareness method. This is a nice little necklace called cycle beads. There are directions how to use it, and it's pretty handy where there's a little ring on it, and the red bead is the first day of your period. The instructions on the cycle beads kind of take you through how to advance the little plastic ring to it. But basically, the white beads are when you're fertile. So if you don't want to get pregnant, then it's best to avoid sex during the white beads time. And if you want more information on cycle beads, you can go online to www.cyclebeads.com. There's also the copper IUD, which I don't have a picture of, but basically looks like this, but it's made out of copper. This is inserted in the doctor's office, and it lasts for 10 years. Women who have the copper IUD continue to have a regular period every month. So you will still have a period if you had a period before every month. Whenever you're ready to try to get pregnant again, it's very easily removed in the office. Now let's review the hormonal types of contraception. Since we just reviewed the copper IUD, let's talk about the hormone IUD. So the hormone IUD lasts for different years depending on what type of hormone IUD you have. So there's a hormone IUD that can last as low as 3 years, and there's one that can last for up to 7 years. So depending on what type of hormonal IUD you have placed, it can last for 7 years. Whenever you feel like you want it removed, again, it can be easily removed in the office. One of the other advantages of the hormonal IUDs, it can help women that have really heavy periods to have lighter periods, and women who have painful periods can have less painful periods also. It looks just like this. It's pretty small. It's placed in the office. Women can have some cramping and discomfort initially when it's placed, and in the first few months after it's placed, up to 6 months to get used to it. But most women do really well with just taking some ibuprofen or Tylenol to help with the discomfort that they have. There's also the good old regular birth control pill. Now, most birth control pills have 2 hormones in them. The 2 main hormones are estrogen and progesterone. If you get the birth control pill that has estrogen and progesterone, typically what it is that there are 3 weeks of hormones, and then there's a 4th week where there's no hormones, and that's when a woman typically has her period. You can talk to your doctors to whether that makes sense for you to have a period. If you have especially painful or heavy periods, your doctor can walk you through how to take your pills so that you skip that week and just start the next one, so you won't have periods as frequently. Therefore, you'll have less pain. There's also the progestin-only pill. That is helpful for women who are breastfeeding. That's something that we can start in the hospital until your breast milk is established. And we don't recommend starting the combined birth control pill with estrogen in it until you're about 6 weeks postpartum. This is great for somebody who has difficulty remembering to take something every day. It's the hormone patch. It has both hormones, estrogen and progesterone, in it. The way that this is used is you apply it to specific areas on your body, one patch for every 7 days. So you put one patch on, wear it for 7 days. It's good in the shower, in the pool. You take it off, and then you put on a new patch in a different area, wear that for 7 days. And you do that 3 weeks in a row. And then your fourth week, you don't wear a patch, and that's the week that you should have a period. The side effects of all the combined birth controls are pretty much the same. There can be irregular bleeding or spotting as your body is getting used to it. I recommend patients to stay on one type of birth control for at least 4 months before we switch to something else, and talk to your provider about what kind of side effects you're having. There's many ways that we can kind of help with the side effects so that they're tolerable as your body gets used to it. Depo-Provera is an injection shot that is given once every 3 months. This is progesterone only. So this is also a good option in women who estrogen is not recommended for. So if you are over the age of 35, if you're a smoker, if you have high blood pressure, you wouldn't want to take a hormone type of contraception that has estrogen in it. The advantages of Depo are similar to the patch, where you don't have to take it every day. It's every 3 months. One of the side effects, the main side effect, is that a lot of women don't end up having much of a period when they're on Depo-Provera, so that can be helpful if you have heavier periods or painful periods. This is the only one that's associated with some weight gain. So it's important to realize that if you are somebody that is super concerned about that and feel like you don't even want to go there if that's a possibility, then I would suggest something other than Depo-Provera. It can also take 6 months to a year before your period becomes normal again after stopping Depo-Provera. This is the contraceptive ring. This is something that is placed inside the woman's vagina. The patient puts it in themselves. You wear it for 3 weeks. It has enough hormone in there for 3 weeks, and then the fourth week you remove it and you have a period. So it's something that most partners don't even realize are there whenever a patient is having intercourse. It usually doesn't bother the patient or her partner, and it's convenient because you don't have to worry about taking something every day. You might have heard of the hormone implant called Nexplanon. This is a small rod that has a type of progesterone in it, and it lasts for 3 years. The advantage of this is not worrying to take a birth control method every single day. It is the most effective form of birth control that's out there currently. It's something that's placed in the office. Side effects of this are similar to any type of hormonal birth control. As your body's getting used to it, is breakthrough bleeding and spotting. You can't see it, it's just under your skin, but you can feel it to know that it's there. And this has been approved for 3 years of use. In the event that you find yourself concerned that you might be pregnant and you haven't used a reliable form of birth control, there is something called emergency contraception. There is a type that's available over the counter without the need of a prescription, and if taken within 72 hours of unprotected sex, can prevent pregnancy. So these are the types of birth control that are available to you out there. I encourage you to have this conversation with your provider during your pregnancy as you're getting to kind of like your 7th month of pregnancy. That way you can get information on the different types of birth control, what your goals are for when you want to have that next baby, and you can bring your questions to your provider. So whenever you do deliver your baby, you kind of have a solid plan as to what type of birth control you would want, and all your questions can be answered. Thanks.